Welcome, everyone. This is a webinar on information systems in public financial management. We're looking at balancing flexibility and accountability during a crisis. For those of you who aren't familiar with CABRI, we're an intergovernmental organization working with ministries of finance and select line ministries on PFM reform issues. During today's 90-minute discussion, we'll hear about challenges and lessons learned using information systems during crises. I'll begin the discussion with a very brief scene-setting presentation on what an information system really is for anyone who's not familiar. Following my presentation, we're fortunate to hear from Mr. Tieno Amadou Ba, head of the Budget Synthesis Division in the Ministry of Economy and Finance of Guinea, on whether information systems provide useful information during a health crisis and whether they are sufficiently flexible. Following Mr. Ba, Mr. Placide Mukwende, Information Systems Coordinator in the Ministry of Finance and Economy and Planning of Rwanda, will share how his ministry has maintained treasury operations and ensured business continuity from a distance during the COVID-19 crisis. Then Ms. Lorena Rivero del Paso, Manager for Technical Cooperation and Collaboration at the Global Initiative for Fiscal Transparency, will discuss how information systems can support COVID-19 transparency and accountability efforts. And finally, before we get to the questions you'll so kindly be posting in the Q&A box below, Mr. Henny Swanepoel, Chief Director of Data Analysis from the Budget Office of the National Treasury of South Africa, will respond to Lorena's presentation. So as mentioned, I'll briefly discuss what information systems in PFM are, what they aim to achieve, some of the challenges we've seen in the countries we work with, and how CABRI will be working with countries through a policy dialogue to address these. So functional PFM systems depend crucially on accurate and timely information sharing, on things around the government's cash position, in-year adjustment, flows of resources, and project implementation, as well as on an efficient accounting system. And both information sharing and accounting systems have been revolutionized over the past 3 decades by financial management information systems. And these, for those who aren't familiar, are automated solutions that enable governments to plan, execute, and monitor the budget by assisting in the prioritization, execution, and reporting of expenditures and revenue. And in this way, a financial management information system should allow governments to make more informed decisions, ensure application of controls, and allow greater accountability and transparency, hopefully increasing the functionality of the PFM system as a whole. However, despite these noble objectives, and over $8 billion spent on information system projects over the past 30 years, recording, reporting, information sharing, and data analysis remains suboptimal. And I thought this was quite nicely illustrated in this article from the Lesotho Times. And although it's from 2009, I can assure you these problems remain very much the same after working in Lesotho for the past 3 years. So this article asks, just what is this FMIS animal that has caused so much pandemonium in our drinking halls? It's now the common alibi that some of my boozing mates used to pass around. Every time it's their turn to buy booze, they start lamenting endlessly about how the system has delayed their salaries or how payments have been stuck at the treasury. Anyway, that's just anecdotal, but really we have noticed these following problems. The information systems depend on simultaneous PFM reforms. So they're never introduced independently, and they depend on complex PFM reforms, including rolling out a standard chart of accounts and a treasury single account. So we'd have to get everything else right in order for the information system to work. There's also a mismatch between the system design and the local context. The systems are mostly off the shelf, implying that they're not designed to suit the local context. And it requires that existing manual processes must fit in with the predetermined design. And then integration. Now, this is a problem in its own entirely. And many countries have tried to go about integrating core budget functions with more auxiliary functions like payroll, public investment management, procurement, and debt management. But by introducing by trying to introduce one central database for all of these. However, this expensive and complex approach has met with little success, and because it allows little flexibility in terms of introducing new technology. Often when one module goes out, the whole system goes out. We had this in Zambia where it went out for 3 months, and you restricted to IT solutions from a single vendor. Then we've also observed data capability gaps, where there's a limited understanding of accounting standards and budgeting practices, an inability to migrate and convert data in a way that would allow decision makers to make decisions in a timeous and effective way. Then institutional coverage is another issue that we've noticed. As countries try to roll out these systems beyond central government to state-owned enterprises, local government, or spending agencies, it's unsurprising, given the problems at central level, that these bring their own challenges, including lack of user buy-in, connectivity issues, lack of HR capacity. And then often we find the systems don't produce accurate and timely reports. So, I mean, this is what the systems are generated to do, and yet we find that the reports either aren't produced in a format that's usable by decision makers, or they're given to economists rather than accountants, and it's not well understood. And then there's been limited progress with incorporating donor funds into these systems, which again implies that the systems can't be comprehensive, particularly in heavily donor-dependent countries. So given the persistence of these challenges and the need for practitioners themselves to start exchanging first-hand accounts of these practical and operational challenges, we are holding a policy dialogue which will provide a platform for practitioners from the budget office and accounting officials to learn from the experience of their peers and, where appropriate, apply these lessons. So CABRI's policy dialogue approach consists of case studies. In this case, we're doing 4 case studies. Now we're doing virtual workshops given COVID-19. We will also, once travel restrictions allow, do a peer exchange event and then a follow-on training event where the topic will be identified at the peer exchange event. And that'll be around 15 countries on the continent that'll join us. And we'll focus on the challenges that we've just discussed, including looking at what kind of data skills you need for effective utilization of these systems, the various challenges and successes specifically in integration, and then given those challenges in integration, looking at some alternative approaches. So, for example, the IMF's modular approach, which is something very pragmatic that the IMF has recommended, that developing countries limit themselves to core functions. And then another alternative option that we've done a case study on is South Africa's transversal system. And this is unbeknownst to most, South Africa has actually never had an integrated financial management system, despite 2 attempts to get there, and has instead operated transversal systems, which, although now outdated, have actually served the country very well. And then we'll look at PFM in the age of digitalization and big data. And this will be an opportunity for practitioners to discuss what the digital revolution and e-government means for PFM. And finally, the focus of today's discussion, we're going to be looking at information systems in times of crisis and looking at how information systems can increase efficiency, effectiveness, and equity in government's responses to COVID-19. I'll now leave it to the panelists who will share challenges and lessons learned using information systems to make data-driven decisions during and after COVID-19, and to track and monitor expenditure and ensure accountability during and after this crisis. Now I'll leave it to Mr. Ba, if you can come on with your presentation. I'll stop sharing my screen. Thanks so much. Mr. Ba, you... Great.
Vous m'entendez? Allô?
Oui, merci.
D'accord, merci. Je disais bonjour à tous. Je vais présenter le thème système d'information pour la gestion financière. Fournissent-ils des informations utiles pendant une crise sanitaire et sont-ils suffisamment flexibles? Pour ce faire, voilà le plan de présentation. On aura une petite introduction. Et en deuxième lieu, je présenterai le dispositif institutionnel mis en place, le cas de la Guinée. Troisième point, ce sont les mécanismes budgétaires qui sont mis en place. Et en quatrième position, je parlerai des principaux points à retenir. En guise d'introduction, je vais commencer par dire que depuis le 6 avril 2020, la Guinée a présenté un plan de riposte économique à la crise sanitaire Covid-2019. Et ce plan a été évalué à 2500 milliards de francs guinéens, soit 270 millions de dollars. Et il comporte une composante sanitaire, une composante sociale, une composante économique et financière qui vise à appuyer le secteur privé dans le cadre de la relance économique. Et il est important de préciser que ce montant de 2500 milliards n'intègre pas les contributions financières attendues de l'extérieur. Pour la gestion de ce fonds en période de crise, l'État a mis en place un dispositif institutionnel ainsi que de divers mécanismes, aussi bien au niveau stratégique qu'au technique. Donc, à ce niveau, il y a un dispositif institutionnel et des mécanismes d'exécution de ce budget au niveau stratégique et au niveau technique. En ce qui concerne le dispositif institutionnel, au niveau stratégique, il a été mis en place un comité interministériel de lutte contre l'épidémie de la COVID le 13 mars 2020. Ce comité regroupe un ensemble des ministres, niveau ministériel, qui composent, qui sont impliqués dans la gestion de la crise. Par exemple, la primature, le ministère de la Santé, le ministère du Budget, le ministère des Finances et le ministère du Développement local, le ministère du secteur privé, ainsi de suite. Et ce comité interministériel a pour mission de piloter et suivre la mise en œuvre de la stratégie nationale définie en matière de lutte contre la maladie. Et à cet effet, il se prononce sur le plan national d'alerte et de riposte que j'ai cité en introduction, ainsi que les différents rapports d'activité périodiques des structures techniques qui sont mises en place. Sur le plan technique, un arrêté conjoint du ministère de l'Économie et des Finances, du ministère du Budget, a mis en place ce qu'on appelle un comité de facilitation et de suivi des opérations exécutées sur le compte Fonds spécial de riposte au Covid et de stabilisation économique. Donc, vous comprendrez par là que cet arrêté a mis en place un comité qui va suivre l'ensemble des opérations exécutées dans le cadre de la gestion des fonds qui sont dédiés à la riposte contre la COVID-19. Ici, je précise que contrairement au financement du plan de riposte contre la maladie à virus Ebola, qui avait fait l'objet d'un budget d'affectation spéciale à l'époque, c'est ce qui a été choisi, la gestion du plan de riposte économique à la crise sanitaire de la COVID-2019 s'est fait par le biais d'un fonds spécial de riposte et de stabilisation économique. Donc, vous voyez, au temps d'Ebola, c'était un budget d'affectation spéciale qui est effectivement prévu par nos textes législatifs en matière de gestion budgétaire. Mais cette fois-ci, compte tenu du caractère urgent et des enjeux, le gouvernement a préféré mettre en place un fonds spécial qui est dédié aux ripostes à la COVID-2019. Les ressources de ce fonds sont logées dans un compte ouvert à la Banque centrale de la République de Guinée et le payeur général du Trésor est le mandataire de ce compte. Ce qui veut dire que toutes les ressources liées à la riposte contre la COVID doivent passer par le payeur général, donc le Trésor public. Les recettes, les ressources qui vont être versées sur ce compte et les dépenses qui vont être exécutées dans le cadre de la mise en œuvre du plan de riposte vont également suivre cette procédure, tout en rappelant que la Guinée, nous avons adopté le système de compte unique du Trésor. Les ressources de ce compte spécial sont constituées des contributions donc, de l'État, l'apport de l'État, les 2500 milliards dont je vous ai annoncé en entrée de jeu. Il y a les contributions des partenaires bi- et multilatéraux et les contributions des particuliers et des entreprises, donc des personnes physiques et morales. Sur le volet dépenses, il convient de préciser qu'elles sont exécutées par voie des régies d'avance spéciales, prises par arrêté du ministre chargé des Finances à la demande des ministres sectoriels concernés. Ici, c'est dans le cadre de la facilitation et de la diligence pour exécuter les dépenses liées à la lutte contre le Covid que le gouvernement a décidé cette fois-ci de mettre en place des régies spéciales qui sont évidemment prévues également dans notre législation en cas d'urgence, en cas de catastrophe. On utilise cette procédure d'urgence pour exécuter des dépenses et les régulariser par la suite. Donc là, on commence par directement les paiements. Après, on remonte les pièces justificatives pour que les différents ministres concernés puissent régulariser et que ça fasse l'objet d'engagement, de mandatement et d'ordonnancement, donc la phase administrative de l'exécution du budget. Les dépenses éligibles à ces régies sont ventilées par nature économique suivant la nomenclature budgétaire en vigueur, telle qu'elle ressortent les décrets d'avance qui ouvrent les crédits supplémentaires pour la prise en charge du plan économique de riposte à la COVID-19. Là, je précise que, étant donné que les dépenses liées à la lutte contre la COVID n'étaient pas prévues dans la loi de finances initiale, en attendant une loi de finances rectificative, des décrets d'avance ont été pris pour ouvrir des crédits supplémentaires à hauteur de ce montant de 2500 milliards. Et la ventilation par nature économique de la dépense, suivant notre nomenclature budgétaire, figure également dans ces décrets d'avance. Par exemple, les dépenses qui sont relatives à la prise en charge par l'État des factures d'eau et d'électricité sont engagées et mandatées sur la base des arrêtés de transfert aux ménages avec pour bénéficiaires les sociétés émettrices des factures. Donc là, directement, dès qu'on finit de payer les factures aux sociétés émettrices, notamment la société d'électricité et la société d'eau de Guinée, et il y a des arrêtés de transfert qui vont être pris lorsque les pièces justificatives vont être remontées au niveau du ministère de l'énergie qui s'occupe de ces deux, qui est la tutelle technique de ces deux sociétés, pour que la phase administrative que j'ai décrite tout à l'heure soit enclenchée, c'est-à-dire l'engagement et le mandatement, lorsque les arrêtés de transfert vont être pris par le ministre chargé du budget, qui va faire le transfert des crédits au ministère concerné. Parce qu'il faut rappeler qu'en Guinée, nous avons un système d'ordonnateurs multiple. C'est que chaque ministre ici est ordonnateur du budget de son ministère. Et le ministère des Finances est ordonnateur seulement des recettes de l'État. Mais toutes les dépenses, chaque ministre est ordonnateur. Il en est de même pour les frais de transport dans les bus et trains de sociétés publiques en commun qui sont pris en charge par l'État. C'est également un arrêté de transfert qui est pris par le ministre du Budget en faveur du ministère des Transports pour que les dépenses soient mises à la disposition des sociétés de transport directement. Pour ce qui concerne les établissements publics administratifs qui sont impliqués dans la riposte, notamment l'Agence nationale de sécurité sanitaire, qui est la structure opérationnelle sur le terrain qui relève du ministère de la Santé, et l'Agence nationale d'inclusion économique et sociale qui s'occupe un peu du volet social pour tout ce qui est appui aux ménages pauvres en termes de transfert de crédits, de transferts monétaires bien sûr aux ménages qui sont très affectés. Et ces dépenses sont exécutées au titre de dépenses de transfert également. Donc là aussi, ce sont dès après l'ouverture des crédits par décret d'avance, et le ministre du Budget prend des arrêtés pour que les crédits soient transférés directement dans le budget des deux agences pour qu'elles puissent exécuter sur le terrain. En ce qui concerne les dépenses d'appui à la relance économique, notamment le fonds de garantie des prêts bancaires aux petites et moyennes entreprises, les fonds spécifiques au groupement d'intérêt économique, elles sont exécutées comme dépenses de transfert à titre d'intervention économique, également par voie d'arrêté du ministère du Budget sur requête des ministres concernés. Là, en l'occurrence, c'est le ministère de l'Industrie et des PME qui est le bénéficiaire de ces crédits pour mettre à la disposition des entreprises ainsi que le groupement d'intérêt économique. S'agissant de dépenses liées à la sécurité alimentaire, elles sont exécutées comme des dépenses de transfert aux ménages, sur la base d'un arrêté également à la demande du ministère de l'Action sociale, qui s'occupe vraiment en lien avec l'Agence nationale d'inclusion économique et sociale des dépenses des familles, en tout cas des ménages très pauvres qui sont très affectés par la crise sanitaire. En termes de mécanismes budgétaires, on a mis en place un système de codification qui permet d'identifier toutes les lignes budgétaires qui sont liées à la mise en œuvre du plan de riposte dans les budgets de l'ensemble des ministères impliqués. Ce qui veut dire qu'à n'importe quel moment, on est capable d'identifier une dépense qui est exécutée dans le cadre de la lutte contre, du plan de riposte contre la COVID-2019 dans tous les ministères. Et c'est une codification informatisée qui est dans notre chaîne d'exécution de la dépense publique, qui permet d'extraire sous différents formats toutes les dépenses, les isoler, les identifier et les suivre jusqu'au moment du paiement. Il en est de même la classification administrative. Les sous-sections sont également créées dans la classification administrative de la nomenclature et insérées dans la base de données du système informatique avec une codification homogène dans les sections budgétaires à qui incombe l'exécution des dépenses du plan de riposte. Là, c'est l'identification des services bénéficiaires. Parce que ici, il y a d'abord le ministère, mais à l'interne, il y a des services qui sont directement bénéficiaires des crédits. J'ai cité l'exemple de l'Agence nationale de sécurité sanitaire, l'Agence nationale d'inclusion économique et sociale. Ce sont des établissements publics donc, dont les directeurs sont des ordonnateurs délégués des crédits qui sont mis à la disposition de leur structure. Donc, à ce niveau, cette codification permet de savoir à tout moment et de retracer toutes les structures qui ont bénéficié des crédits dans le cadre du plan de riposte. Il y a également une classification fonctionnelle qui permet de reclasser l'ensemble des dépenses exécutées dans le cadre du plan de riposte, indépendamment du ministère ou le service qui a effectué la dépense. Il vous souviendra qu'à l'entame de ma présentation, j'avais indiqué que le plan de riposte comporte un volet sanitaire, un volet social et un volet économique. Donc, cette classification fonctionnelle permet donc de reclasser ces dépenses suivant cette catégorisation-là. Qu'est-ce qui est allé au volet sanitaire directement, soutien au volet sanitaire, qu'est-ce qui est allé au niveau du soutien social et qu'est-ce qui est allé au niveau de l'appui à la relance économique. Donc, c'est cette classification fonctionnelle qui permet d'identifier et de retracer cette catégorie de dépenses. En matière de reporting, la chaîne informatisée des dépenses permet de restituer à tout moment la situation des opérations exécutées sur le compte de riposte contre la COVID-19 sous divers formats. On peut le sortir par ministère, comme par service bénéficiaire, par nature des dépenses, comme je l'ai dit, par ventilation fonctionnelle, suivant les 3 catégories que j'ai indiquées tout de suite, c'est-à-dire volet sanitaire, volet social et volet appui à la relance économique. Donc ça, la classification fonctionnelle permet de le faire et le système de reporting peut également sortir des formats à tout moment. Alors, quels sont les principaux points à retenir? Il est important d'indiquer que l'utilisation d'un budget d'affectation spéciale lors de la lutte lors de l'épidémie Ebola, et le mécanisme n'était pas suffisamment maîtrisé par les différents acteurs. Si les postes de dépenses étaient plus ou moins connus au niveau du PAS, l'identification du volet ressources a connu quelques difficultés, notamment sur la partie contribution des bailleurs bi et multilatéraux. C'est pour cette raison qu'avec la COVID-19, il a été privilégié la mise en place d'un fonds de concours qui permet de retracer les apports des bailleurs ainsi que les contributions des personnes physiques et morales. Donc là, vous voyez ces deux mécanismes différents. Pendant l'épidémie d'Ebola, c'était un budget d'affectation spéciale et dont la restitution a posé d'énormes problèmes. Jusqu'à maintenant, on n'est pas parvenu à faire vraiment un reporting complet des dépenses et des ressources qui avaient été utilisées lors de l'épidémie Ebola. En matière de codification budgétaire, pendant l'épidémie Ebola, il n'a pas été possible de créer des codes spécifiques tels que j'ai indiqué en passant, c'est-à-dire ventilation économique, ventilation fonctionnelle, classification administrative. Il n'a pas été possible de le faire, ce qui rendait difficile leur restitution. En fait, à l'époque, on ajoutait les crédits de lutte contre Ebola aux crédits budgétaires qui existaient dans les ministères. Donc, ce qui fait qu'il fallait des retraitements très complexes pour qu'on puisse extraire juste les dépenses ou les recettes qui ont servi à financer la lutte contre l'épidémie Ebola. Donc, mais cette fois-ci, avec le plan de riposte et le mécanisme que je viens de décrire, le système de qualification permet d'isoler à tout moment les dépenses concernées pour des fins de restitution et d'audit. Les procédures d'exécution des dépenses du plan de riposte contre l'épidémie Ebola n'étaient pas suffisamment respectées en raison d'une mauvaise maîtrise des textes législatifs et réglementaires et du manque de textes d'application. Là, j'ai fait allusion en fait à nos textes législatifs et réglementaires à la matière, et particulièrement la loi organique relative aux lois de finances qui date de 2012. Donc, en 2014, les dispositions de cette loi n'étaient pas suffisamment maîtrisées et il y a beaucoup de textes d'application donc de la dite loi qui n'étaient pas encore pris. Ce qui fait que, par exemple, c'était la première fois qu'on mettait en place un budget d'affectation spéciale. Pratique.
I think he may be frozen. Mr. Ba, are you still with us?
Bon,
I see his presentation is changed. Mr. Ba? I do believe he is not with us now, but I think this was possibly the last.
Sur le plan institutionnel, le rôle des différents acteurs impliqués dans l'exécution du plan de riposte à l'épidémie Ebola n'était pas clairement identifié. Comme je l'ai dit au début, ici, il y a vraiment tout un mécanisme, tout un dispositif institutionnel qui est mis en place cette fois-ci, alors qu'au moment de Ebola, il n'y avait que ce comité interministériel qui était très loin de la réalité. Il n'y avait pas, en tout cas, un dispositif technique qui permettait de jouer l'intermédiaire entre les structures opérationnelles sur le terrain et le comité interministériel. Et également, même sur le plan informatique, et tout ça, tout ce dispositif n'existait pas au moment de l'épidémie Ebola. Donc, en conclusion, dans la pratique, la mise en place de l'Agence nationale de sécurité sanitaire en tant qu'opérateur unique d'intervention dans la gestion des crises sanitaires depuis l'apparition de la maladie à virus Ebola a permis de mieux organiser la réponse contre la pandémie COVID-19. Même sur le plan du montage du budget de la riposte, la mise en œuvre a été cette fois-ci plus facile et plus spontanée, ainsi que les différentes restitutions qui se font de façon hebdomadaire et de façon mensuelle. Donc là, je précise que chaque semaine, le comité technique dresse un rapport, élabore un rapport et le rend au ministre du Budget, au ministre de l'Économie et des Finances. Et chaque mois, un rapport sur la mise en œuvre de ce fonds de riposte est publié à l'attention du public et il est accessible à tout le monde. Voilà, donc c'est ce que j'avais à dire sur cette brève présentation et je suis disponible pour les détails. Je vous remercie.
Thank you so much, Mr. Barr. That was really interesting and also really reassuring that although there's been one epidemic and one pandemic, you've grown so much from the experience of the first one, and it's comforting for other countries to know that building resilience into the systems is possible. So next we have Mr. Placide Mukwende from the Ministry of Finance of Rwanda, who will take us through how the ministry has ensured business continuity during this time. Thanks so much. Over to you, Mr. Mukwende.
Thank you, Daniela. I'm sharing my screen. Okay, can you see my screen well?
Yes, it's fine, thank you.
Oui, oui,
okay.
On le voit.
Okay, thank you, Danielle. Thank you, the CABRI team, for the invitation. It's a pleasure to be here with you for the first time. This is my first presentation to CABRI, and I'm glad to present and share the Rwanda's experience during the COVID-19 period, which is helped us to ensure treasury continuity from a distance. During my presentation, I will present the Rwanda Geography and Connectivity, which is one of the key enablers in maintaining treasury functionality and the FMIS ecosystem under which we are operating. What are the functional coverage, how FMIS is integrated with that system, including the FMIS usage. I also share with you the process, how during the COVID, before the COVID, and after the COVID, once the lockdown was imposed, how did we modify our system to support treasury? Then lastly, it will be the lesson learned and challenges. Starting with the Rwanda geography, Rwanda is a small country with the 26,000 kilometers square. It has a 12 million of population. 12 million. It's not big in terms of area. However, it's somehow bigger compared to the actual population. The Rwanda is divided into 5 provinces, and those provinces are divided into 30 districts. Districts in other countries, they are regarded as counties, and each district is divided into what we call sectors. We have 30 districts, and those districts are divided into 416 sectors. Why am I presenting this? Is because service provision in Rwanda to the citizen is at the level of district and sectors, such as school administration is at the level of sectors, health centers at the level of sectors. However, hospitals are managed by district, like counties. Now, another fact is Rwanda, we have a great percentage of mobile penetration. We have around 9.3 million mobile phones distributed across the country. And the government has established a fiber optic network, which is covered 3,000 kilometers. We have also, this fiber optic network is connected to 4G LTE antennas, and plus the mobile penetration, it's offering 90%, 95% of internet coverage across the country. Which means if you have a mobile phone in Rwanda, you are able to go anywhere and still have internet coverage. Now, this is screen present actually where FMIS is operating, how are we connected, and let me then give you the situation of how our FMIS is built. Our FMIS is built, it's any in-house system. It's was developed from scratch under the administration of Ministry of Finance. I personally, before becoming the coordinator, I was the designer of the system. I participated in the design of the system, and later I became the coordinator, coordinating the development, design, even rollout of the system. Our system is a web-based application, which is accessible over the internet, and we are covering the whole, around 95% of the public financial management cycle. And we support cashless payment. Going there, in fact, the way we operate, the budget, the cycle of PFM, we start with the planning. All plans in the government are prepared within the system online, except part of the planning consultation to citizens. Those are offline. Those districts and the sectors, they meet citizens offline. However, when it comes to interim action plan, they go online, they provide the action plan online. And we are currently upgrading the planning to offer a result-based planning and budgeting for accountability. And once the plan is ready, it's time for budgeting. The planning is feeding the budgeting. Now, the budgeting is when the ceiling is submitted by the national budget. The Ministry of Finance submit a ceiling to each and every institution to say, okay, you are proposing to spend this, but this is the resources we have. Now, institution will go there and then allocate budget according to their ceiling. Once the budget is enacted by the parliament, now the FMIS send the budget to the e-procurement. E-procurement is also another tool under the PFM, which offers high degree of transparency in spending government money. For example, if you are in South Africa or anywhere in the world, you can go to Umucho and see that all the tenders and start bidding. You can bid wherever you are. For authentication, we are using digital certificate for Umucho. Even if we are in the process of implementing the same in FMIS, we started with the pilot phase for Umucho, then we shall upgrade the FMIS to allow implementation of digital signature. Supplier, they sign their contract online. You don't have to come to Rwanda to bid and sign your contract. You can sign anywhere you want. Now, once the budget is available, sorry, the procurement is over, we receive contract in FMIS. FMIS receives contract from e-procurement. Now, once the invoice is available, the process, we start the process of payment process where control of budget, control of contract, control of commitment, and cash plan is available under the payment, which means treasury operations are maintained under the payment process. And the FMIS is linked to the internet banking of the National Bank of Rwanda. The National Bank integrates with commercial bank. If you are to pay, say, a supplier has tendered. Now, a contract is available in FMIS. You start the payment, you process the payment, then the supplier will receive his or her payment via the commercial bank. All these are integrated and you can start a payment, and after 10 minutes, the supplier is going to receive the money on his or her account in the commercial bank. Everything is done online. Banking system is online, the internet banking system is online, taxes are online, which means we connect also to the tax authority to check whether those suppliers are legitimate suppliers, are not ghost suppliers. However, for international suppliers, we don't have another way of verifying except that we rely on documents submitted by suppliers during the registration on the e-procurement. Now, another integration we have is the integration of payroll. All government employees, they are recorded and recruited under a system called IPPIS, which is managed also the payroll. Now, during the payment, once the human resource has finished preparing the payroll in in IPPIS, they send it electronically to FMIS. The payment again is prepared in FMIS, sent to the National Bank. The National Bank, once users like treasuries approve in the internet banking, the National Bank internet banking send those instructions for payment in commercial bank. Again, here, there's no delay in paying the government employees. Everything is done online. Our FMIS also has a module for receipt management and for managing revenue, government revenues. We have also an accounting system. Everything done here, it feeds the accounting. We have also the inventory and asset and inventory management system, such that if you procure something and you pay for it, then it has to fit. If they are goods, they have to feed the asset and inventory module. We have also a reporting module for reporting all financial statements and consolidating financial statements of all those entities. The system administration is reserved for security and configuration of the system for better management of the system. Now, that was the functional coverage. Now, let me show you now how the institutional coverage, which we call the usage. During the Danielle presentation, I saw that there are challenges when it comes to coverage. For us, we are covering the whole public sector, except public enterprise. All other agencies and ministries, they use FMIS. We have all ministries, all agencies, provinces, development project means donor-funded project. We have all embassies across the world. They use FMIS. We have the judicial entities like prisons, courts, and so on. They use FMIS. We have under the local government, which means the city of Kigali and district. District, they administer district hospitals, district pharmacy sectors, administer health centers and public schools. For example, if we are to transfer money to schools, you prepare everything in FMIS and automatically at the end, the school will receive the money on their account. Not all the schools will be responsible for accounting for that directly. They can even, some schools, we have a module for financial management to their schools. However, others, like primary school, because they receive little money, we don't, again, go there to say, how did you spend money, because it's little money. However, for health centers, we account for everything. In total, we have 4,180 entities and 12,385 users. Okay, now, you understand the system is covering every corner of the PFM. However, during the COVID, before the COVID and after COVID, how did we operate? Before the COVID, on the treasury side, accountant or budget officer, they used to prepare payment in FMIS and print the payment, print the supporting document, and they bring them to the head of finance and the chief budget manager. Chief budget manager, they are people leading ministries or not ministers, like permanent secretaries leading ministries or executive or CEOs leading institution. They sign them, stamp them, then they had to bring it manually to the National Treasury. Then the National Treasury, we rely on the authenticity of submitted and stamped and printed document. Then we'll verify that in the system, approve them in the system, then send the electronic payment to the National Bank for authorization, and money goes to the commercial bank. Now, the issue here was we have the payment part, which is cashless, which means because the payment has been prepared in FMIS, everything is in FMIS. However, when it comes to authenticating this payment, we are relying on papers. You have to print and scan and stamp. Now, this was a challenge during the COVID. People, during lockdown, people, they have to come to Treasury. And exchanging paper might lead to contaminating the COVID-19. What we did is to say, why, if everything is in the system and we have a law allowing us to go fully digital, we said, let's now remove this transportation of document. Then, instead of printing, document data in the system, they have to stay in the system. However, supporting document, scan them, then attach them in the system. Then the head of finance and the chief budget manager, they have to come in the system, they have to log in and approve the supporting document in the system. Then send electronically the payment request to the National Treasury. The Treasury verifies, approves, and the process goes there. The change was only here. Remove the transport of hard copy document and send electronic document to Treasury. However, here you understand there is still a challenge. You still have to scan. The reason why we are now implementing a digital signature like the e-procurement system, so that even some of the supporting documents, they don't have to be scanned and printed. We have to integrate with other systems so that documents, they are signed there and submitted to FMIS. Now, what did we learn during the whole process? Rwanda, we have a great political will. The political will is the primary driving factor that governs smooth running of the National Treasury. For example, imposing all leaders, like the head of ministries, to have credentials for FMIS to come and authorize their payment in FMIS it's not an easy task unless you have a great political will, where you can impose controls and people, they have to follow those controls. Now, we had the law which supported the enforcement of that controls. In Rwanda, even if you Google this law, you can find it. It's online. A law that allow people, they enforce the usage of electronic signatures, electronic messages like email. Today, all the courts in Rwanda, they rely on this law. You can submit a case online, and all lawyers, everything involved in the justice system will go online. Even we have what we call Rwanda Online, where citizen services, they are offered online. Means a citizen, they don't have to go to the counties or sector to get the service. They have to go online. We have a platform called the Rwanda Online. Now, all the platform, they are online, and the key enabler is this law, which support the usage of electronic messages. Another key factor is having a small country which is well connected. This facilitated in the having a fully fledged FMIS that covers the complete, all the service provision of the government. For example, if you say school, you can pay a school and the school will receive money on their account. And you may, if you want to pay, you can pay somebody via the mobile money, via their bank, without any issue. The availability of IT infrastructure is also a key enabler. Now, coming to the in-house system, FMIS, because it's an in-house system, we have a great flexibility of modifying and enhancing the system based on the dynamism of the political will of the government to go fully digital. For example, we couldn't change the system in 2 weeks if we had an off-the-shelf system. It could have been difficult to modify the system and help the treasury. Again, coming here, another lesson we need to learn is because having a system that can control what people they are doing, accountability goes with has 2 factors. There is system controls and there are human controls. Our system is offering the 2. We provide system controls and there are human controls because human, they have to verify also what the system has done. However, you can only enforce system controls to control what the human they are doing only if there is a political will. Again, the transparency offered by the system is because everything is online. Supplier, they can see how the budget is being spent via the procurement. Institutions, they monitor how treasury is paying because they all share the same system. We don't have a treasury system which is separate from the institutional system. They are all using the same system. And coming back to the challenges, one of the issues we faced during the COVID increased in attack over cybersecurity. Now, however, the advantage we had a disaster recovery. We have a national data center which is in the cloud, and we have another data center in the Ministry of Finance which works as a backup, which means we can switch between the 2. Now, however, the challenge is that having an infrastructure which is of a high availability to all the institutions with a great security, it's very expensive. The reason why, whenever people are implementing FMIS, high availability, you need to balance the associated cost and the coverage. Are you going to cover all the entities, or if you don't cover them, what is going to happen? Are you going to have a full-fledged FMIS? The reason why again, the political will must be there so that you don't run into the analysis paralysis situation where you can't take decisions because every decision you can take is a challenge. What we have learned is that whatever the decision you are taking in implementing FMIS, you have to take a decision that will keep things moving forward, not suspending everything. You need to have an open mind of saying, we are taking this decision because it's going to offer accountability, transparency, and you don't have actually to say, this is a challenge, let us not do it. So I would like to thank you once again for inviting me in this session, and looking forward to work with you again in the future. Thank you.
Thank you so much, Mr. Mkwende. That was excellent. Always impressed by Rwanda. So on that note of transparency and accountability, I hand over to Lorena from the Global Initiative for Fiscal Transparency. Thanks.
Thank you all. I'm going to share my screen as well. 1 second. Okay, there we go. Okay, so I think this presentation from Rwanda and Guinea before me were also a great introduction to this. So I am going to be speaking about good internal systems for good external publication, and I hope that the title is clear and why by the end of this presentation. So I am from the Global Initiative for Fiscal Transparency, and we work with governments and civil society around the world to improve how fiscal transparency is implemented, as well as how public participation is integrated in the budget cycle. So COVID comes in, and we have this situation of emergency. And the first thing that we see is everyone running around and thinking about how we are purchasing supplies, right? Ventilators, how we are buying masks and so forth. So the first point of interest comes when we are thinking about the procurement part. But then we start seeing the complexity of this emergency. And we've had previous emergencies, and I think it's important to think about the COVID-19 as an introduction to start thinking more of how emergencies need to give us more flexibility and how we can work towards a better data architecture that will allow us to have the flexibility and the data that we need. So we started seeing the need for data on purchases to make decisions from inside of government, but also for transparency. But then just start dimensioning that it's not just about this emergency, because we also had a very important effect on oil prices, and oil prices are not impacting just the purchases, they're impacting the revenues. So for revenues, we also need to change our macroeconomic estimations. So we have a lot of variables that are undergoing here that are further than just the budget integration and the procurement part. So we have a complex situation. So we have drafted these 6 reasons why we need fiscal openness in times of emergency. So we need to trace the design and implementation of measures. So, we were hearing how Guinea is providing certain support and providing grants. We need to measure and be able to trace not only who is receiving this, but how these measures are designed, to know what the effect is and what are the trade-offs. Why this type of grant and why not this other one? And this can only be done if we have the data to know this. The second one is identify fiscal sustainability and flag potential risks. So yeah, from the part of budget, we need to know if we are spending correctly, efficiently, and effectively. But we also need to know the debt sustainability. And right now we have a discussion on cancellation of debts and their sustainability and requiring more loans. So this is an important thing to consider when we are speaking about transparency in this moment. I already kind of mentioned improved efficiency and effectiveness in fast decision-making. This is the fast decision-making here is the clue, because usually we get the data, we get the reports, but right now we need the data to be more agile, and we need to have it fast in the right hands to make decisions and to analyze trade-offs. And for this, we need certain granularity and more real-time data. That's a further complication. What's already in the minds of most people is combat or detect corruption of mismanagement. I like to have this one as a fourth level, because it's certainly very important, but sometimes this is the only thing in mind when we speak about transparency and accountability. But there are so many variables in this context that need to be taken into account. So prevent or detect corruption or mismanagement. The next one is make sure that measures that are meant to be temporary actually are. So we say that we're going to have, there's a discussion on solidarity taxes. And these solidarity taxes, are they going to be temporary? What's the sunset clause on this? So we need to know all this information, so also to give certainty to taxpayers and to the public in general. And also, if we're going to have certain grants, are they going to end someday? Is there a temporality of this? If we're changing our budget cycle, if we are going to start presenting our executive budget proposal after, because we are in the middle of COVID, when is this going to end? So what changes are going to be enabled in the budget cycle that we need to be able to track and know? And finally, the sixth one is enable informed public participation. So we need the people that want to participate to have the correct data to participate in an informed way, and not just in an inquisitive way and speculatory. So these are six reasons, but one important thing here is that our publication and our openness is only as good as the data gathered. And here I am not mentioning as the system that contains it, but the data gathered. And why is that? Because we might be in this aspirational way in which all core public financial management processes are inside of one financial management information system, right? So we have our wonderful FMIS. That's our aspiration. They are all interconnected, and the data infrastructure is within the Ministry of Finance and line ministries, and all institutions are using the same systems. We have no duplication of data, and line ministries are using the same system, and they don't have duplicated systems that could have inconsistencies with the data that they are reporting. We have efficient systems where inputs are easy and are flexible to adapt. So right now we were just hearing how in-house systems provide us more flexibility on adding certain categories when we need them, instead of off-the-shelf systems that give us a much more structured and different needs to include or have the flexibility that we know in times of emergency. And finally, for transparency, we have our internal systems connected to the publication through a data portal, either through a direct connection, an API web service, or through data warehouses and intermediate this. So this is our aspiration. And you see, most of our cases, we don't have that. That is something that we need to discuss. And I think that is part of what we need to discuss here, because most of us are focused on the budget systems, but there are so many other things that we need to discuss as well. So from GIFT, and I see that some of the people here in the forum have participated on this, we have been tracking what data not what systems, but what data is required to manage the emergency. So for the emergency, we have found 4 categories of data we need. It's emergency and counter-cyclical spending. So what is the budget, but not just for the emergency, not just for health, but also anything that we are doing to preserve jobs or to support businesses and so forth. Tax relief measures and deferrals. This is usually not inside of the core Ministry of Finance, but in the taxing administration. But there we need to know, for example, what are all the tax expenditures that we are going to have, but also who is benefiting from this, who are the beneficiaries of tax expenditures, to know if they are being progressive enough. We need to know the revenue adjustments and any additional funding sources. For example, we were hearing about the trust funds. So the trust funds have been an important issue or an important topic in the management of this particular crisis in many countries, particularly in Africa. And these trust funds are being used usually as additional funding sources. And finally, the 4th that I was just mentioning, when we are analyzing the whole situation, is the macroeconomic framework impact. So we need all this data to actually understand what is going on, and not just for the public. It's information that the ministries of finance need to think about gathering, because sometimes they don't have it at hand for the correct decision making at the moment that it's required. So we have created this fiscal data for emergency response guide. We were thinking of this as an initial implementation for COVID-19. Well, it should be expandable because this is not going to be our first or only crisis or only emergency. Unfortunately, we are constantly going to be thinking of seeing emergencies. We are in the middle of discussions on climate change and more, and you have the experience of Ebola that we were hearing. So we should be prepared on the data point of view. So it's fiscal data for emergency response. And this is 15 data sets plus 10 time series that we should have at hand. This has been built through consultations with ministries of finance and civil society organizations from different parts of the world. I saw Charlie there, who has been very active in this guide, and some other people that have been giving inputs to this. And why do I focus more on the data rather than in the systems? Because in the middle of a crisis, it's very hard to think about fixing the systems that are not there. So if we don't have the systems before the crisis, it's very difficult to have them in the middle of the crisis. So what can we do right now? So not just focusing on the systems, what has been done in Rwanda of very agile response in changing the system is wonderful. But what can you do if you don't have the system to adapt? So systems are based in data models, and that's something that we should have in mind. And as much as we would like to receive everything in a system, and we can't, we should consider the relevance of gathering structured data. So even if our system, maybe it's covering 90% of our operations, but what about this other 10%? So use data collection that is structured, not just press releases, not tables, not PowerPoints for the minister. We have been seeing that a lot, and then gathering the general results of this emergency for a press conference that were on a PowerPoint, and then bringing that back and replicate it. So considering structured data. What if the systems are fragmented? So this is a common case that systems are fragmented. So maybe fixing the interoperability of systems is more complicated, but standardize the form of collection of the data. So here's the example that I have, and you might say, okay, so my country does not have that much experience in the development of financial management systems. Well, in this example I have is the United States financial management system, that since it's not integrated completely but by an agency, they have developed a model schema to recover the data. So to compile the data, they have gone through another way of doing a data schema to compile the data in a standardized way. So even if you don't have a system or the systems are fragmented, if you standardize the collection of data, there are ways in which you can go around this and collect the correct and quality data. Leveraging systems for control, transparency, and auditing. So here I wanted to show you some examples. Yeah.
I'm going to have to ask you to wrap up in the next minute or so, just so we have some time.
Okay, so I am going to just go through leverage systems for this. So I have some tips on this. Use systems for all the resources, not just the core. First, change the process. With that, adapt digital solutions. So the process comes first, the digital solution will come more naturally. Choose agile development. So these big developments that allows us to replicate, do the requirements and iterate and deploy, and always create this construction over. Embed automatic controls as much as possible, not so many manual or human managed revisions. When systems are not available, use data schemas and flatten data as opposed to reports as much as possible. Another couple tips: if the systems do not speak to each other, make the data speak. So create these interconnections with the data through the correct IDs and codes. When designing a system, think always, what do you want to use the data for? And what do you expect to use this data? How are you expecting it? What tools and capacity do the people that are going to use the data for decision making have? And finally, distinguish between the hype and the worthwhile innovations for your system purpose. I keep hearing, let's use blockchain for this, blockchain for that, but what is the actual need that you have to develop in your system? So distinguish between hype and purpose so that we have a much more efficient generation of FMIS. So I can wrap up there.
Thank you so much, Lorena. Thank you. That was excellent. So Henny from the National Treasury is going to come in and respond to Lorena's presentation. Henny, if I can also ask you to touch on this question from Nicholas Baton, who's written extensively on information systems and public financial management. And he asks, do you feel that FMIS systems are integrating enough monitoring functions, enabling to produce and follow relevant indicators on public policies, and not only support core functions? In the context of COVID-19, can your FMIS, well, and not South Africa doesn't have an FMIS, but support trade-offs between projects and support efficiency? What is missing in current systems to get there? So if you can incorporate that into your discussion.
Thanks, Daniela. Thanks, Lorena, for the presentation. It is quite a mouthful to respond to. I think just as a very short background, as you mentioned earlier, we do not have an IFMIS yet in South Africa. We are in the process of developing and implementing, and I hope that before I see my grave, I will actually see our IFMIS. It has been quite a challenging project in South Africa. I think we're now at a point where we are going off the shelf, and we are working with Oracle in that regard. And it's looking promising, but it's going to be quite a bit of time before we get there. I think from our side, what has made the whole COVID issue quite a challenge was the fact that in terms of our old systems, people had to physically transact from the offices, and we had to keep our central IT system and IT offices manned the whole time, which was quite a bit of a challenge. So I think in the first few weeks of the lockdown, things went relatively slow, But we then designed a few interventions to ensure that people are on site and that we can get payments through. So in that sense, you know, there was a bit of a slowdown, but I think we are now running at full steam. I think the other thing that helped us a lot in the sense of getting our reporting sorted is the fact that we have got a standard chart of accounts that we implemented a number of years ago that provides information across multiple sectors or sections segments in the chart. So it's quite easy for us to identify sources of funding and then to link sources of funding to individual spending items and individual projects. And what we have done immediately as we started thinking about spending additional money on the COVID interventions was to give departments very specific directions on how to transact, where to report transactions, and how to structure their chart or to adjust their chart in order to be able to report in terms of COVID. We also, in the process of allocating, we were very specific about the funds that was going towards the COVID response. So a lot of the funding that we've identified comes out of our normal grants frameworks. Within those frameworks, we specifically identified funds for individual responses at different levels of government. And it will be quite easy at the financial management level to monitor the implementation and spending in terms of those programs. I think where the big challenge is going to come in, and I think that's through, even if you've got a proper FMIS, is not just about the actual money being spent, but the impact in terms of the spending. You know, a lot of programs are focused on ensuring specific healthcare initiatives, welfare initiatives, and things like that. And it will be very difficult, I think, to really monitor who benefits and to what degree people have benefited. And, you know, that information is just not always available in your financial systems. I think when it comes to something like social grants and your social grant payment systems, in there, I think usually people have a lot of information. You could identify the specific individuals that benefited. It will be relatively easy to do. But when it comes to something like the health sector, it's going to be a huge challenge because how are you going to distinguish, you know, medicine that is used for COVID purpose from general medicine, if we can call it that? Or, you know, things like oxygen or whatever the items may be. So there will be a huge spike in expenditure. Some of it you will be able to link directly to the COVID interventions. You know, we've set up temporary hospitals, we brought in additional staff, and those it's easy enough to link. But there's a huge part of the spending that's just going to fall into the general pot. And there I think it's going to be quite a bit of a challenge to start reporting to start reporting on it in future. I think we are lucky in the sense that our chart is running reasonably well. So a lot of the financial reporting will just be automated. We are already setting up the reporting processes, and as from next month, I'm hoping to start releasing some of that information as a first part of our reporting process. I think a lot of the other information one would probably only capture after the fact when you get to your annual financial statements. And I think that also gives one a bit of time to really think about what it is that you want to see and how you want departments to report on that. And in that process, we will design, you know, reporting formats specifically that would support our AFS. I'm actually quite interested in Lorena's 15 data sets to kind of understand what it is that people really want to see. I think, you know, the quicker we can, as all countries can start implementing that in our basic reporting structures, it would be just a lot easier to provide that information. From our side, I think we are quite committed towards providing open access to the information. We've developed a data portal where most of our information is published on an ongoing basis. We have actually now gotten to the point where detailed transactional data is published in that data portal on a quarterly basis, so that everybody has got access to, to all kinds of detailed transactional level information. I think on your issue around the issues of procurement and corruption and stuff, that is unfortunately the reality in life. Is wherever there's money floating around, there's always somebody on the lookout to grab a piece. What we have tried as the National Treasury is for the big expenditures to rather go for transversal type procurement processes. So, for example, our medicines and the PPEs and stuff that we bought for the hospitals and those programs, we negotiated very quickly large contracts with a number of suppliers. We centralized the process of delivery so that there's good controls over the distribution. Now, one can always question if you get the best deal in town, if you go down that route. But I think from a kind of mismanagement, corruption point of view, that was quite a useful exercise. And it will also give us a great sense of being able to monitor what has gone through that process. Because, the companies are specifically identified, we can easily pick them up in our financial systems, we can extract the data, and we know exactly how much money has gone to each of those for what purpose. So in that sense, I think a useful exercise. I think on your point around the issues of risk and fiscal sustainability, as you might know, South Africa was already in a very tight spot before we entered into this COVID crisis. I think we are all very scared of our latest debt to GDP ratios and the future of these. And there's a huge debate ongoing at the moment in the country around fiscal sustainability and how we are going to manage our debt portfolio in an environment where currently I think the economy actually needs a lot of input from government and a lot of money that has to flow into to try and support. But fortunately, I think we've identified those issues up front. I think that broadly, I try to make notes on the side here. I'm not always that fast when it comes to this, but I think that roughly covers most of the things that I quickly wanted to touch on.
Thank you so much.
Thanks.
Appreciate that. So we've only got 5 minutes for questions. The panelists have been typing out, and we will get to all the others via email. But we have a question here for Mr. Barr from Elta. And Elta asks, in Guinea, does the underlying system allow monitoring of transactions against the COVID response fund at commitment of funds and at the payment phase? And she asks if she's understanding correctly that the chart of account allows for more detailed, in terms of economic and administrative classification, reporting to donors because of the way it is set up as a fund. So if you don't mind answering that, Mr. Barr. Thank you. You'll need to unmute yourself and then thank you.
Merci beaucoup. C'est une question très intéressante. Effectivement, le dispositif qui est mis en place permet quand même de suivre toutes les étapes de l'exécution des dépenses sur le fonds COVID, le fonds spécial. Et comme je vous ai dit, on a un système de compte unique du Trésor. Donc, toutes les dépenses sont payées par le payeur général du Trésor. Donc, la phase comptable est complètement respectée. Donc, prise en charge et paiement. Et comme c'est des régies spécifiques qui sont mises en place, ce qui va se passer, le paiement est effectué dès le début et les régularisations se font plus tard suite à la remontée de toute la documentation qui est prévue par la réglementation en vigueur. Et là aussi, tout se fait sur la base de la chaîne de dépenses. C'est un système informatisé qui est là au niveau du ministère de l'économie et des finances, dans lequel tous les intervenants interviennent, que ce soit les ministères sectoriels ou le Trésor public jusqu'à la Banque centrale. Donc, les opérations sont suivies et toutes les restitutions qui vont alimenter les différents rapports périodiques qui vont être produits sont extraites de cette chaîne informatisée de dépenses. Et comme je vous ai dit, tous les ministères en tant qu'ordonnateurs ont accès à cette chaîne de dépenses, évidemment avec des codes spécifiques. Et même la régularisation qui se fera après, la phase d'engagement, liquidation, ordonnancement de la dépense, se fait au niveau de cette chaîne informatisée de la dépense. Et c'est vraiment quelque chose qui est vraiment nouveau cette année, parce qu'avant, au temps de Ebola, par exemple, comme je vous disais, pratiquement tout se faisait hors système informatisé de la dépense. Donc, pratiquement, le ministère des Finances n'avait même pas une idée globale de tout ce qui est versé en termes de contributions, alors qu'actuellement, toutes les contributions sont versées au niveau du Trésor public, avec des quittances à l'appui. Donc là, au jour le jour, le ministre des Finances est au courant du niveau de ressources encaissées et de l'exécution des dépenses sur ce fonds spécifique à travers des régies spéciales qui sont préparées à la demande des ministres concernés. Donc, ce sont des informations vraiment qui sont disponibles à tout moment. Comme je vous ai dit, de façon hebdomadaire, les ministres du budget, les ministres des Finances sont informés du niveau d'exécution du fonds Covid et le reste du public a droit aux informations chaque mois sur la base du rapport que le comité technique qui est mis en place produit. Et ce rapport fait l'objet même de publication par le Premier ministre sur les médias publics chaque mois. Il passe sur les médias publics pour présenter le niveau d'exécution du fonds Covid, aussi bien en ressources qu'en dépenses. Je ne sais pas si c'est un peu clair.
Thank you, Mr. Bell. So very, very quickly, Mr. Mukwende, our last question, then we'll close. From Sheila Max McCarthy from the Accountant General's office in Sierra Leone, who I worked with in 2017. She asks, were new codes set up for COVID operations in your chart of accounts? And if you can just answer very briefly, and then we'll have to wrap up.
You mean where do we put the code for the COVID-19?
Yes, so in terms of the items of expenditure, did you develop a new chart of account code, or how did you do it? Did you use others?
What we did is simply to add new item in the chart of account. Those items that are related to the COVID, which means we didn't modify the chart of account. It's simply adding new expenditure line for the COVID. Nothing else.
And that was that a simple task to do in terms of, was everyone able to use the same codes?
Yes.
Okay, so no challenges.
No challenges there.
Okay, all right, excellent. All right, well, thank you so much. I'm sorry I've seen the panelists did answer most of the questions, but anything else we can do via email. I think this was a really interesting discussion. I'm grateful to everyone who joined. There will be, following this, a series of virtual workshops with a selected group of countries, where we will be going deeper into the various discussions that we started today and more broadly than the crisis. So thank you very much, everyone. And thank you to the panelists. You were excellent, very insightful, and I'm grateful for your time and preparation. Thank you so much.
Thank you very much, Daniela. Bye.
Thank you. Thank you, Daniela. Thank you, everybody. Bye-bye.
Bye-bye. Thank you.